Well, here we go. All right, Dr. Martin, children and sealants. Are sealants really a really good thing to protect children's mouth? And let me ask you, could sealants be put on the first set of teeth and the second set of teeth? How long do they last on an average? Go ahead and tell us about it so that we know.
Well, sealants can last. It depends on the environment in which you replace them. But sealants should last you at least a couple of years, maybe 3 years, and over time the children will wear it down with their eating and all. But sealants can help many kids because they're so busy at that age between 5 and 10, where they're just like inviting everything on a regular basis. But if you place the sealants, then at least you're like minimizing the exposure to those foods that cause cavities.
I see.
I mean, it still takes them to keep up with the brushing and the flossing and all. Actually, most children don't end up flossing as much as you would like them to, but they actually do brush much better when you encourage them to.
Mm-hmm. Now, and those sealants get put on the back teeth mainly, I assume?
Yes, on the biting surface of your posterior teeth, yeah.
Okay. And let me ask you, so when a child has his second set of teeth at the age of, 10, 12, give or take, does sealant still appropriate for him? Are they still useful?
I wouldn't necessarily go in that direction. I guess it depends on if they look like they're actually not doing well as far as eating foods that cause cavities. You may have to end up doing that just to help them through.
Who doesn't eat food which doesn't cause cavities?
I guess
we don't have for nothing obesity going on from children to adults, and we're eating hot dogs and we're eating everything is sugar laden like crazy. Even the orange juices you buy in the store are like they have as much sugar as Coca-Cola in it if you really look at it. So who doesn't?
Well, everybody does. It's just how often do they do it? I think that's what really ends up being the point. I really wouldn't want my teeth. I wouldn't want to have to do something to my teeth just to stop it from having cavities, unless there was cause to do that. I wouldn't do that just on everybody's teeth.
Okay.
There are some people who their diet is much better than most.
And I guess you see that by looking at the teeth and say, look, your teeth overall look okay, that there's not too much cause, let's just leave it. Or like, hey, I can see certain patterns, let's put them on.
Correct.
All right. Okay. Well, thanks a lot, then. That's, so we people can have some information and some data about, what can be done and what maybe should be done and what are things for. I appreciate your candidness.
Thank you.